Hi, and thank you for your interest in the General Surgery Residency Program here at Indiana University on our main campus here in Indianapolis. My name is Matt Ritter, and I'm the Program Director for General Surgery. And over the next few minutes, I'm going to give you an overview of what your training would be like if you came and joined us. First, if you've never been to Indianapolis or to Indiana, there's a lot to do. Indianapolis is a large city of just under 1 million. Most of you have probably heard of the Indy 500. We have a bustling and quickly growing food scene, as well as a great sports venue. We've hosted the Super Bowl, frequently host the NCAA tournaments, and have a lot of fun doing that. A little bit about me. Prior to coming to Indiana in 2020, I was active duty military for a long time, serving as program director at Walter Reed National Military Medical Center in Bethesda, Maryland. I like skiing and lots of other outdoor activities. This slide is my family, my older daughter, my son, and my wife. My daughter just graduated from James Madison last year. Other program leadership listed here. We have a full cast of leaders, most of whom you'll meet during the interview process. And then our chair, Dr. Bill Amoria, who was lead author on the first and second trials that has really examined closely the issues of wellness in surgical education. I'll throw our mission statement up here, not necessarily for you to read, but just to understand where we're coming from. We really value surgical education at IU, and we pride ourselves on being a premier program for evidence-based innovation to produce graduates not only to be surgeon scientists and scholars, but general surgeons for Indiana and the rest of the country. A little overview of what I'll cover today. Touch a bit about our philosophy in the department, as well as for education, some of the educational opportunities, of course, resources, and what you can expect if you train here in terms of experience clinically as well as from a board standpoint. So this is kind of how we think about our role as residency program leaders. So it's our job to put together a program for you that has all the opportunities you could possibly want or need to become an effective surgeon across the spectrum of general surgery, and to really create and foster an environment that is conducive to learning. We'll talk more about that in a second. What your job is to really take full advantage of these educational opportunities. As you'll see, we have no shortage of opportunities in our program, and I think you'll enjoy experiencing all of them. And we want you to contribute to the positive learning environment, being both leaders and teachers to those who follow. One of my favorite leadership books, and one of the concepts we really try to foster in the program, is this concept of radical candor. Hopefully some of you have read this book by Kim Scott. But the core of this is the combination of caring personally about individuals as well as challenging them directly. And that combination of caring personally and challenging directly really leads to the most foundational growth. You can see a little graphic I've lifted from the text here that talks about the different ways these axes can fall, but we really focus on staying in this right upper quadrant as our target for leadership and education in our department. The clinical education opportunities are very vast here. We have currently seven different clinical sites we rotate at. On the left of the screen here, you see IU Health sites, so Methodist Hospital, University Hospital, Riley, IU West, and IU North. We also have a regional referral VA hospital on campus, and then Eskenazi Health is our community hospital network, and we have the main hospital of that network on campus as well. As interns, you'll go to 5 of these 7 hospitals, but the program incorporates all the hospitals. Some additional some additional resident professional development programs. We have a robust technical skills program in our department-run surgical skills simulation center. We do team-based skills in combination with emergency medicine, primarily around trauma. We actually have a full-time sports psychologist on faculty, and we have a mental skills curriculum to help give you tools to deal with stress in and out of the operating room, and when you have to perform your best when things are falling down around you. We teach you how to be teachers. We teach you how to be researchers for those who choose that additional professional development time, and then focus some on a business curriculum as well as life skills. This is our surgical skills curriculum. We do a vast curriculum all the way from core skills that you'll develop as a PGY1. You see some listed here, up to full procedural simulation in animate and inanimate tissue models, as well as virtual reality. Here's some clips on the vast array of different teaching sessions we have in our department-run skills center. These are mostly mannequin-based simulations. This is in our larger simulation facility where we do our team training. We have 2 robotic consoles and a patient cart on site, as well as frequent visits from Intuitive for larger courses for residents on a weekly basis. We have a robust and quickly expanding ultrasound curriculum as well. Some national courses that we deliver, you see here, both those funded by the American College of Surgeons, ATLS, ASSET, ATOM, and ultrasound courses, as well as fundamentals courses, which are requirements for board certification that were developed by SAGES. We are test sites for all of these, so you don't need to travel to get any of these certifications under your belt. For conferences, we have protected time on Wednesday morning, similar to many programs, starting with M&M and Grand Rounds, followed by a longitudinal education curriculum based on the SCORE outline, Surgical Council and Resident Education. This is the same outline that board exams are blueprinted off of, as well as in-training exams. So focuses on the core patient care, medical knowledge components of training. In addition to that, there are additional protected time meetings and conferences around education at different hospitals, and you see some of these above me here. These each have a different focus based on the rotations at those hospitals, but there's a robust and at least weekly allocation for protected time for these type of traditional conferences. Research opportunities, half to 3/4 of our residents will opt to do 2 professional development years. There are many in-house research opportunities, and those opportunities are growing rapidly. Dr. Markle did a separate recording focused specifically on research, so please check that out. This is a quick overview of some of the opportunities internally. External opportunities are also available, and then the department will not only fund your salary during this time, but fund you to acquire a master's degree, and these are examples here of some of the more common master's degrees that residents in their professional development time pursue. Other types of resident engagement best practices that we've incorporated at IU are listed here. I won't read all of these, but many of these are taken directly from and included in best practice guides that are distributed nationally. I will highlight that we have a robust resident council that helps give input and guidance on resident issues to program leadership. We have a great new parental support policy and really encourage across the board resident involvement in the leadership of the program. So some more nitty-gritty numbers. Will I get to operate? These are some numbers from the last several years showing resident performance on cases. I have a slide later that will show how this compares to ACGME requirements. This is our last year's graduates, and you see those numbers are consistent, and then you see the requirements to the side. So we are significantly exceeding all the requirements to give you a robust across-the-board experience. This is one slide that kind of breaks down what we call the different defined categories from an ACGME standpoint. So this is skin and soft tissue, head and neck, alimentary tract, etc. This is meant just to show how balanced our program is. We have great numbers across the board without any real significant area of weakness in terms of operative experience. Will you pass your boards when you're done? Here's some data showing our QE, which is the written board exam, and this should be CE, our certifying exam. That's the oral exams. And we have a fantastic track record of performance on those. This slide shows us compared with some of our peer institutions nationally, and this is not meant to say we're better or worse than any of these, but it just shows you the variability of very well-known institutions, and very infrequently do people maintain 100% board pass rate for extended periods of time. So we're very competitive, likely with all the institutions that you're considering. What do our graduates do? Here's a list of what last year's graduates did. As you see, 8 of the 10 went into fellowship, 2 into practice, and you can see those listed here. If we project that over a larger area, and I will hopefully move my face here. You see this is over the last decade or so, the different fellowships or practice opportunities people have gone into. And if we focus more on the last few years, this is 2020 to 2024 fellowship and practice choices for graduates. So you see been successful across the board: pediatric surgery, surgical oncology, transplant surgery, as well as MIS and other training programs. So what can you expect as you roll into interview day? You'll see here structured interviews with 2 rooms of general surgery faculty, all the associate program directors, Dr. McDowell, Dr. Mong, Dr. Terrace. They may or may not have another faculty with them in the room, and then each of you will meet with me one-on-one to chat and definitely give you time to discuss there. We also have some unstructured and discussion Q&A options for you. You will meet with at least 1 pair of general surgery residents. You'll meet with Dr. Troy Markle, who's our Vice Chair of Research. And then there's also an opportunity to have a one-on-one time with the program coordinators, Mimi, Stacy, to just ask them questions. The program coordinator time is optional. Everyone will have at least 1 full break during the day as well. So thank you again for your interest in our program. We really look forward to meeting you. I want you all to know as well that if you were invited for an interview, it means based on our very extensive holistic review process, you are already very well aligned with what we value as an institution. And we have good confidence that you have the knowledge, skills, and attitudes required to be successful in our program. So thank you again. Look forward to talking to you more, and have a great day.